in the United States, in the recent years, the death toll from drug overdoses exceeded 100,000 lives per year. And this is a shocking number, and illegal drugs actually are an issue in almost any country. Governments, of course, try to solve this problem, but to understand the effects of different things that governments can try, we should understand how consumers respond to these policies. For example, governments can do drug seizures, but consumers can respond to a seizure like this one by substituting to other drugs, and this will make the seizure less effective. Governments also can legalize some drugs, for example, cannabis, and you can see on the right that in the US, some people hoped that legalization can alleviate the opioid crisis because consumers would substitute cannabis for other more dangerous drugs. Finally, governments also can try to prevent introduction of new synthetic drugs on the market. And if governments do this, implicitly, they prevent consumers from substituting towards these new products. So substitution is important. And in this paper, we ask two research questions. First, we ask, how do drug users demand illegal drugs? In particular, we want to understand how they substitute different drugs. Once we can answer this question, we can answer the second question, which is, what are the welfare effects of different drug policies? Usually, studying drugs is extremely difficult because the market for drugs is not legal and essentially is unobservable. And we solve this problem exploiting the unique context of this Darknet marketplace that was called Hydra. So Hydra was by far the largest Darknet market in the world. It operated in Russia. And the American government says, in 2021, if you take all Darknet markets worldwide, 80% of all cryptocurrency transactions there actually came from Hydra. So we scraped Hydra to look into drug prices, drug quantities, and behavior of individual drug consumers. And we can do this, in particular, because of the unique distribution system that Hydra had. So consumers would essentially pay for information that would allow them to go to the city and pick up the drug that was hidden there before. So they would receive GPS coordinates and a photo to locate the package with the drug. So sellers, after hiding drugs, would post on the website information about these pre-hidden drug stashes. And when we scrape the platform, we see the approximate location, the amount, and the price of drugs that were hidden. So in fact, this allows us to observe the market for drugs so well that we even can say that cocaine, which is the most expensive drug in any country, in Moscow was mostly sold in the center of the city, while synthetic drugs, which are much cheaper, were mostly sold in the outskirts of the town. Finally, we also observe reviews. And we can use reviews to study how individual consumers switch between different drugs. So we can identify several consumption patterns. This matrix tells you how someone who reviewed a particular drug buys drugs in other time periods. And first of all, we can see this diagonal here. And this diagonal tells us that consumers typically buy the same drug. And of course, this also means that people are different and have different tastes, because different people buy different drugs. We also can identify several clusters of drugs, in particular, this cluster of amphetamine, MDMA, and methadone. And we observe active substitution within these classes. So this motivates us to develop a model of drug consumption. So we develop a mathematical model of demand for illegal drugs. In this model, consumers will choose whether to consume drugs and what drugs to consume. All consumers are going to be different in this model in the sense that they will have different tastes. And they will make their choices responding to prices and characteristics of drugs they see on the platform. So we estimate this model of demand for illegal drugs using the data we scraped from Hydra. And then we can use this model to study the effects of different drug policies. In particular, we study cannabis legalization. This is our most important application. And legalization makes cannabis more accessible. We find that legalization can actually lead to a large increase in cannabis use, but at the same time, there is going to be substitution away from other drugs which are more dangerous. And we can use our model to quantify this trade-off. And we find that if the society wants to reduce consumption of other drugs by 1 dose through legalization, the society would have to accept 4.5 additional cannabis doses consumed. And so this is the trade-off the governments should think about. We also study policies like targeted drug enforcement. So these are policies which target specific drugs, like drug seizures or crop eradication. An intuitive result is that targeting a particular drug is more effective if this drug has no close substitutes, because then consumers cannot just switch to some other drug. We can use our model to provide a list of perfect targets for targeted enforcement. So we find that drugs like alpha-PVP, cocaine, and opioids all have few substitutes. At the same time, these drugs are also the most dangerous in terms of their health effects. So they seem to be perfect targets from this perspective as well. However, drugs like MDMA and amphetamine, we find them to have close substitutes, and these drugs are also less dangerous in terms of health effects, so they seem to be bad targets for this kind of policies. So with this, let me conclude. We can observe the market for drugs at an unprecedented level because we scraped data from the largest darknet marketplace that ever existed. We use this data to first motivate and then develop a mathematical model of demand for illegal drugs. And then we use this model to study effects of different policies that governments can do. In particular, we studied cannabis legalization, and we find that it can achieve a reduction in use of more dangerous drugs, but the cost will be a large increase in use of cannabis. We also study targeted enforcement, and we can use the model to guide these policies and find drugs that seem to be perfect targets for this kind of policy. Thank you.